The DEA says that they have found more than 40 pounds of fentanyl in a drug bust in the Bronx, just blocks from the daycare where a baby died after being exposed to fentanyl earlier this month. CBS 2's Bauman sat down with the DEA special agent in charge of the New York district about where the fentanyl is coming from and why he says New York is a hub for these drug cartels.
This suspect was moving large quantities of fentanyl powder, and it was also being prepared for street-level distribution. This is indicative of a mid-level to high-level heroin, meth, fentanyl distribution network that we're constantly seeing here play out in New York City.
How did you find this guy?
We identified this suspect under surveillance. We observed this suspect move on and off the New York City subway system with a rollaway suitcase, which was later identified as the mechanism that was moving and carrying the 13 kilograms of fentanyl that we seized. So that's an alarming fact that this individual was moving in our transit system with lethal fentanyl in a container, in a suitcase, a rollaway suitcase.
Where was he coming from, going to? Why was he taking it on the subway?
So what's typical of the drug trafficking networks that we are constantly engaging in and investigating is they move their drugs around the city in clandestine ways. So this trafficker was moving large amounts of fentanyl in a rollaway suitcase from one destination to another. And in this instance, he was moving it into the mill so that they could process it and break it down into smaller quantities for street-level distribution.
40 pounds, how does that compare to other seizures that you've had here in New York?
So 40 pounds is a significant seizure. What I would tell you about that is that equates to roughly 1 million potential lethal doses of fentanyl that we remove from New York City streets. And when we talk about the lethality of fentanyl, we're talking about just 2 milligrams. That's what can fit on the tip of a pencil. This is what's killing Americans at record and catastrophic rates. One person's dying every 5 minutes. And the predominant driver of fentanyl, the #1 cause of overdose deaths and poisoning in the United States is fentanyl at 70%, but here in New York City, it's at 80%.
If people are taking this on the subway, should New Yorkers be carrying around Narcan just every day?
What I would tell New Yorkers is that they should be vigilant and aware of their surroundings at all times, and they should make sure that they are aware of what they're touching, and then obviously clean their hands as often as possible. This powder is very fine. It can get into the air. It can certainly lay on surfaces, but to ingest this lethal poison, fentanyl, it would be very difficult to absorb through the skin. It would have to be through an open cut or through an orifice like your mouth, your nose, or maybe the corner of your eye.
So for the Bronx daycare with these babies, I don't know if you can get into it, but does that mean that they were ingesting it, like they may have ingested it in their mouth?
I think it's speculative in terms of how they got into their bodies. I think that the situation that played out in the daycare was so reckless, and the fentanyl powder was in so many different places in the daycare that powder could have laid dormant on many different surfaces, and it would be easy to pick up, and those toddlers, those babies, were put in such harm's way by really irresponsible people.
Does it seem that those two operations were connected in any way?
What I can tell you, Allie, is that these are probably independent organizations operating for their own profit and greed. But what I will also tell you is that if there is fentanyl here in New York City, that fentanyl originated in Mexico. And the two most dominant cartels responsible for the flow of fentanyl into the United States is the Sinaloa and Jalisco cartels. And our mission right now is to save lives, but it's also to defeat the cartels, Sinaloa and Jalisco cartels. And those are the ones that we're mapping, we're understanding who the facilitators, organizers, and distributors are, and this organization will tie back into Mexico.
How are the drugs getting here?
Allie, these drug traffickers are very resourceful, very innovative, and they use any means necessary. They will utilize vehicles, they will utilize human carriers, they will utilize mail parcels, they will use shipping containers, basically any possible way to move that illicit commodity from Mexico into the United States is an option for them.
Last year, it was something like 15% of the fentanyl seizures the DEA had in the U.S. was in the New York area. Why is there so much fentanyl in New York?
So, Allie, this is a destination city. This is the hub of the Northeast. So all those drugs, the powder, last year we seized 2,000 pounds of fentanyl powder and 2 million fentanyl pills. That equates to 65 million potential lethal doses of fentanyl. It's coming here because it's being further distributed to the Northeast. And it's here because the I-95 corridor is a great geographical location for these distribution networks to move that powder into mills and or places to hide, conceal their drugs, stash houses as we call them, for further distribution throughout the Northeast and sometimes even down into Philly.
So New York is the hub for the Northeast, and why are we seeing it in the Bronx, with this past month alone?
The Bronx is geographically positioned in a way that facilitates these distribution networks to move that poison into the Bronx for further distribution throughout New York City, but also into the Northeast. And it's prototypical of the drug trafficking organizations to have mills spread out throughout the city in plain sight often, as you saw with this recent seizure. This is a typical apartment in New York City, and our investigations oftentimes discover and reveal the insidious ways in which these traffickers will move their drugs and also conceal their drugs.
So if New York is the hub for the Northeast, then the Bronx, is it fair to say, the hub for New York?
The Bronx is definitely the most strategic location of the 5 boroughs for the traffickers to continue their illicit trade. It's also the borough that has the highest amount of overdoses and poisonings of the 5 boroughs.
So what do you do to prevent the drugs from getting in the Bronx and getting in New York?
So, Allie, we're targeting the entire supply chain of fentanyl. We're going after these cartels relentlessly. We're mapping the networks. We're understanding who the facilitators, organizers, and shippers are. We're understanding where the illicit finance comes into play. So we're looking at the entire supply chain of this production, of this poison that's moving into the United States, and we're making a significant impact by holding them accountable, arresting these individuals and bringing them to justice.
The fact that we had these two in the same neighborhood in the same month, these two busts, is that coincidence, or is that telling you something about what's happening with the cartels and with the trade right now?
Fentanyl is everywhere. It's in everything. It's in all drugs. It's in cocaine, heroin, methamphetamine, and oftentimes New Yorkers and other people who are substance use dependent believe they're taking cocaine when in fact they're taking cocaine laced with fentanyl, and they're dying at record rates. And so every New Yorker should be outraged, not just with the overdoses and poisonings, most definitely with babies being poisoned and one dying, but also at the reckless abandon in which these traffickers are moving this poison throughout New York City and stashing it in places that we come in contact with, that people live and play and work. And so that's what I think New Yorkers need to be mindful of, that this is everywhere. And we should be on guard, and we should also do more to stop this harm.
I mean, is the problem getting worse, or is it staying the same, would you say?
I would say that the flow of drugs into the United States is definitely increasing, and we're seizing more and more drugs every day. Last year, there was a record number of overdose deaths. This year, in 2022, there was 110,757 overdose deaths and poisoning in the United States. That's a record number. That's a number we've never seen before. Our job has never been more important and more critical than it is today.
And in terms of the two cartels in Mexico, I mean, I think in New York, a lot of times we think about the cartels as this faraway thing that's happening, south of the border. But since we're seeing these mills here in New York, does that mean the cartels are here in New York?
The cartels are most definitely here in New York. The cartels are in 50 different countries. They're in every state in the United States. The cartels are the ones that are driving this epidemic. They're the ones responsible for the poisonings that are happening across the United States today. And they're doing that intentionally, deliberately, to drive addiction, to increase profits. And this is their business model. And this is what the DEA is dedicated to do. We're committed to taking out these two cartels. We're also committed to increasing awareness, prevention, and education. And we want to provide medical assisted treatment to those who need it the most. Those are our 3 priorities. But right now, as indicative of this investigation, we're interdicting the supply chain of this fentanyl that's flowing into the United States.
And in terms of the bust with Herrera Vargas, the guy from the subway, I mean, do you think he's been working alone, or do you expect more arrests to be coming from that bust as well?
It would be rare for him to be working independently or by himself. This is an organization, and we will unravel that organization, and we will hold them accountable. This is the objective of the DEA. It's called the Global Pursuit. It's to track the traffickers here in New York City all the way back to Mexico. And that's what we're doing every day. That's what we've done in years past, and that's what we'll continue to do going forward, is save more lives.
You know, I think that there are a lot of people who've heard these last two stories and are freaked out. One in a daycare, one on the subway. I mean, what should New Yorkers know about what's happening and how they can keep themselves safe?
So, Allie, this is our strategy, is to educate more people. Our One Pill Can Kill public awareness campaign, we've put out a number of safety alerts to the American people. We have a website, DEA.gov, that has fentanyl awareness tab on it that people can learn more about fentanyl. We have different products and different information that's available to the American public that they can download and they can use. Educators, people in areas of responsibility, caregivers can now use this information to educate the most vulnerable. And we want people to understand this is the most urgent threat to the United States today. This is a public safety, public health, and national security risk. And the DEA is committed to holding those cartels accountable and saving more lives. That's our mission.